Hello, my name is Tony. We live in Orange County, California. I came here to visit Dr. Jaude for the first time with my wife 2.5 weeks ago. But I've been asked to give you a little bit of a historical sketch as to what's happened. And this all began for us about 5 years ago. My wife was a very avid tennis player and started having some difficulty in her shoulder. And because of that shoulder difficulty, she chose to seek out the help of an orthopedic surgeon that was recommended by her general practitioner. This orthopedic surgeon decided she needed an epidural injection. And we weren't really aware of that. We thought she was getting a shot of cortisone in her shoulder for her discomfort. But it turns out that she received an epidural injection up here in the cervical area. And unfortunately, during that attempt to give her the epidural, they, by mistake, penetrated her dura, penetrated the coating on the spinal column, and caused a leak of spinal fluid. Within a couple of days, her headaches became so excruciating that she was really unable to function, and the only way she got any relief was by laying flat. After a couple of days of this, they felt the spinal fluid leak, and they chose to do what they called the blood patch, which was to patch this leak. Well, unfortunately, during the attempt to do the blood patch, they penetrated the dura a second time. And after 11 days in intensive care, where they gave her a complete spinal drain and pulled all of her spinal fluid out, apparently they felt that the holes in this dura area had corrected themselves. Unfortunately, it's been a slow, steady downward spiral since then. She's never played any kind of tennis since then. Slowly, we saw her losing her energy. I just felt, okay, she's getting a little bit older now like the rest of us, so maybe she's not going to be able to play tennis any longer. But then we started really noticing, I think 6 or 8 months ago, her ability to do the day-to-day tasks that she had always done really started to slip away. She was an avid babysitter for our 12 grandchildren, wasn't able to do the stuff she had done on a regular basis, and the day-to-day tasks started to become very difficult. Finally, on a Sunday afternoon, about over 3 months ago, I thought my wife was having a heart attack. She had all the symptoms that I'd ever read of a heart attack. Never thought it would be applied to her. I never imagined her having a heart attack in a million years. But I rushed her to the emergency room in Orange County, where they also were very convinced she was having a heart attack. And because of that, they took all the precautionary measures that were necessary, including after a day in the hospital, they decided to give her an angiogram. And that angiogram showed no problems. So we've now spent the last 3 months or so visiting, we started with the general practitioner who referred us initially to, well, we had a cardiologist while we were in the hospital. Cardiologist, we saw him several times. He was sure there was no cardiac-related problems. So then we went and saw an endocrinologist because they saw a tiny little problem with her thyroid numbers, but very small. We went from the endocrinologist to a pulmonologist. We saw almost every ologist, I suspect, that exists over this last 3 months. And slowly but surely, I felt I was losing her. She continued to spiral downhill, wasn't able to walk from one side of the room to the other without help. She got so weak. I was really scared. We were both really scared. Last thing we were told by traditional medicine, by a neurologist, is that the only hope we would have, because they thought it was possibly chronic fatigue syndrome, then we were told it was fibromyalgia, then we were told it was MS, then we were told it was probably ALS. If you ever read anything about ALS, that will scare the living daylights out of you if you read that for a bit, because there's no hope. And the last thing we were finally told is that she had we had to submit her into a program at a diagnostic hospital like UCLA, where I felt like we were just kind of going to offer her up and allow them to do whatever they needed to do to attempt to find out what was going on. I think the thing that bothered my wife the most was not getting a diagnosis. It's hard to imagine, but I think she was genuinely disappointed the day we were told she didn't have MS. Now, if you can imagine being in such a bleak circumstance, and I think she was disappointed because of that hopelessness. Luckily, one day we were here in the desert. I happened to pick up a Healthy Times newspaper where there was an article about Dr. Jodie. I carried that newspaper home before even opening the article to Orange County, and I opened that evening laying in bed. Started to read a little bit about what Dr. Jodie did, something about the fact that in his very primary exam he does a bilateral blood pressure. We'd been telling doctors for months that her blood pressure in her two arms were as much as 40 points apart. We're told in the emergency room, no, that's impossible. That's traditional medicine told us that. We find out that Dr. Jodie, that's part of his basic exam. When I read that, I knew this guy understands what's going on. He talked about the misdiagnosis of the fibromyalgia and chronic disease syndrome and all this chronic fatigue syndrome and this whole group of maladies that nobody could really put a tag on as to what the problem was. I finally convinced, we went to a hormone specialist who gave her these bioidentical hormones to try to bring her back. And it was obvious after a few weeks of that was going nowhere. So we thought the court of last resorts was the hospital diagnostic program, and that's when Dr. Jodie's information happened to drop in our lap like a gift from heaven. I don't mean to overstate that, but it's the truth. And the day I practically dragged my wife in here because she was so distraught, so slipping away, emotionally, mentally. She'd really gone into a basic depression, not a clinical depression, but my goodness, wouldn't anyone be depressed after 3 months of that kind of misinformation going around? Well, within about an hour or so in this office, it was obvious that Dr. Jodie totally understood what was wrong with Mary. Mary was scared because our primary care doctor was told by the neurologist that he felt the problem was probably in Mary's mind. Not in her head, not in her brain, in her mind. She heard that and started to maybe believe it because nobody could put a tag on this. And within that first hour in Dr. Jodie's office, he looked her square in the eye and he said, "Read my lips, it's not in your mind." And that was the turning point. That was the single turning point. We've been coming here now for just over 2 weeks. We've been in Dr. Jodie's intensive program of 2 treatments a day. Right now, you would not know this is the same woman I literally dragged in here 2 weeks ago. She's got the spunk back in her step. She needs no help to get from one room to another. We got a ways to go, I know, but man, she's light years ahead of where we were when we got here. She's absolutely convinced, and so am I, so are our children and our grandchildren, that this is really different. For the first time, we were way past having hope. That was at the beginning. We're absolutely convinced, and it's undeniable. Right. It's the fact of life. So I offered to do this because I feel greatly indebted to Dr. Jodie and Dr. Tina for helping us to really save my wife's life, because she was going to die, and it was a matter of time. So I'm very proud to be here.